so that I don't have to participate
Right.
in my own abuse anymore.
Right.
I don't have to victim blame myself. I don't have to judge myself because I feel this way.
With trauma and addiction, how they go hand in hand a lot of the time.
Welcome to the next Women in Recovery podcast. It has been way too long, so we're very, very happy to be here today. Thank you, both of you lovely ladies, for coming to share space with us today. I'll just take a minute. First of all, I'm Alisa Wood, and
I'm Lacey Garcia.
I'd like to introduce our guest today, Jenny Netto, a very dear friend, colleague, mentor, sister, all of the above. Just very, very excited and honored to share space with you today.
Me too. Thanks.
About a topic that is very, very dear to my heart. And that is very, very difficult to talk about for many of us. Today's episode is specifically focusing on trauma and how we as women get to come together to heal from trauma. What is trauma? What does that mean? What does that word mean? What are the effects? We'll just kind of see wherever the conversation takes us.
Okay.
First of all, before we dive in, I want to take a minute and, as I was thinking about this next episode and putting this together, Jenny was one of the first that came to mind for me. One, knowing you and getting to work with you day in and day out, and being able to witness your heart and your passion. And the love that you give to this world is pretty beautiful and something to aspire to. And as long as I've worked in this field and been in recovery myself, I continue to see it's those of us that have had the deepest hurts that have the deepest passion also.
Yeah, I agree.
You know, those of us working in the industry, whatever role, therapist, whether you're, in a therapeutic role or not, those of us that have had some of those experiences tend to be able to relate on levels that we wouldn't otherwise. And those tend to be the most powerful healers also. So, as I was thinking about this, and again, this is a topic that is very, very dear to me, being a survivor of trauma personally, in multiple capacities and areas. It is, I believe that we as women get to empower each other to heal together. My hope for today's conversation is for this small dialogue and conversation to spark a much larger conversation out there in the community, amongst us together as women, but just the community as a whole. So with that whole tirade, Jenny, it is just such an honor to share this space with you.
Oh, thank you.
And get to know you a little bit closer, and just see where the conversation takes us. So thank you both.
Thank you. And yes, Jenny, thank you for coming.
Yeah.
I'm very excited to hear more about you.
Yeah.
I come to you a lot and talk to you about my things, so I'm excited to get to know you on a different level.
Yeah.
As deep of a level as you're willing to go, but
Sure.
I'm glad you're here.
Yeah, thank you.
So let's just take a deep breath.
Sure.
So Jenny, and again, like, I just want this to flow natural. There is no agenda. There is no, like, this isn't an interrogation.
Fair enough. Fair
Kind
enough.
of.
Yeah.
Kind of,
Right.
a little bit. I might put you a little bit in the spotlight.
I'm okay with that.
But I'm just excited to see where the conversation takes us.
Awesome.
So, that being said, if you don't mind, let's just start with introduce yourself.
Yeah.
And who you are, what you're about, who is Jenny Netto.
Sure.
And what makes you Jenny Netto.
Yeah, I think that's a loaded question, but I think I can attempt to tackle that. So obviously, I mean, there's a lot of different aspects of me and who I am and why I make I'm making assumptions about why you guys have asked me to be here. So I feel like just throwing those out on the table, I think, is going to be relevant contextually, but then also I can bring in the human side of me too. So my profession, I'm an LCSW, so obviously you guys both know this, but I'm a therapist by trade, but also by passion, by choice, by calling. There's a lot of different reasons why I do what I do. But ultimately, when it comes to the work that I do, what really drew me to this field was my own lived experience. And I don't know if many people know why I decided to be a therapist, what really guided me down that path, but it fits in line with trauma. So I'll just kind of start there. I experienced pretty complex trauma from birth to age 7-ish, 7, 8-ish. I don't have an exact timeline in my mind. Complex sexual trauma, I think, is important to clarify. And the details are irrelevant, but I do think the part that is relevant is when I decided to tell my parents what was happening to me, I think their response changed my life. My parents, I told my dad nonchalantly in the car on the way home, and just said, I don't like when Grandpa does X. And my dad was like, okay. It's like 7:00 on a Tuesday. Did like my 7, 8-year-old just drop this bomb on me in the car in the garage? And so again, this is my adult mind putting sequence of events together. My dad called my mom. My mom was out eating dinner and was eating at a restaurant that she will never eat at ever again. And I don't know like the timing of the next steps, but I do know that once I told my parents, I immediately was taken, within days to the police station. We began the process of getting me help, of getting my family help, of advocating to keep me safe. I never once, I take that back. I once saw my perpetrators after the abuse, after I told, and that was by choice much later. It was a really important empowerment process for me, which I'll get to in a little bit. So I saw them one time again and have really never seen them since. So for me, that was so crucial. I was believed by the first person that I told, and I was believed by every person I told thereafter. And so Crime Victims Reparations, which some people may be familiar with, paid for me and my family to receive therapy services after I came out about what was happening to me. And I was like the worst client in the whole world. And I would sit in the office with the therapist with my arms folded. I wouldn't talk. I just would sit silent. And I was a kid that did not talk a lot. I spent a lot of time by myself. I colored in my room a lot, and that was like my sanctuary and my safe place. And so when all of that happened, I finally got put with a therapist at a place that's still in business today. It's called ISAT, Intermountain Sexual Abuse Treatment Center. And I got placed with a therapist, and I will never forget her name. Miss Shelley was her name. And that's what I called her. I don't know if that was actually her name. But
That's her name.
Yeah, in my mind it is.
That's her.
Yeah. So I was put with her, and I remember sitting in her office doing what I always did, arms folded, silence, wouldn't talk. And she shared this analogy with me that, like, for whatever reason, blew my damn mind. Like, as a little kid, I was like, okay, like, I got that. Like, that makes sense to me. And basically the analogy, it's really simple, but the analogy essentially was I had chronic stomach pain. And that is really common in little kids that are survivors of sexual abuse. And I had chronic stomach pain, and it would never go away. And I had all these issues with my belly. And so she used my tummy pain as like the way in. So she made this analogy, and she asked me just randomly, like, if I had ever swallowed an ice cube. And I just remember being like, well, yeah. And she said, how does that feel? And I'm like, it hurts. And she mentioned an ice cube, and I think she also gave the example of a Jolly Rancher. So have you ever swallowed one of those two things when you didn't mean to? And so basically what she described as, when you swallow an ice cube, the only way to get it to melt is to continue taking deep breaths. And you have to melt the ice cube, right? And so she told me that the ice cube in my belly, because you get stomach aches when you swallow ice cubes. And so she said, my emotions were like ice cubes in my belly. And the only way that I could access that to make it melt was to take deep breaths and was to start talking. And that was like seriously mind-blowing for me. So for whatever reason, I started talking. Like, I talked to this lady. I don't even remember what I told her. I remember I had puppets. I remember she'd have me draw things. I remember going to like kids groups where I would have to like draw details of my abuse. And I remember all these weird little things that I would have to do. But the ice cube analogy is the one thing that stuck with me more than anything that I did with her. And I don't remember exactly how long I worked with her. It felt like forever. But in my little kid brain, I mean, everything felt like forever. So the timing of it, I'm sure I could figure it out. But, and I remember just thinking, like, if I can help people the way, and this was a little bit later, but if I could help people the way that she helped me, that'd be really cool. And, when I was a little kid, I joke, like, I was born a codependent. I like cared about everybody. I remember crying because I would walk by people's stores, and I think I've shared this with you guys. Like, I'd walk by people's stores, and they wouldn't have patrons in them, and I'd feel sorry for the owners and feel like I needed to go in and like buy things because I just like wanted to help everybody, and I felt overwhelmed by like the magnitude of my desire to help people and not knowing how to channel that and what to do with that. So when I met with Miss Shelley, it gave me kind of a idea of what that could look like, because I wanted to do it everywhere, but I didn't know how. And granted, I'm like this little kid that's traumatized and doesn't know what the hell she's doing, right? As a kid, I would lie about weird shit. Like, I made up crazy stories and not realizing, and no one knew what was happening with me. So it was just this very weird time in my life where now I've run into people that I knew in that period and were like, yeah, you were the girl that did X, Y, and Z. And I was like, oh yeah, that never happened. Like, that so wasn't true. But I would say stuff that was just outrageous. And so then kind of fast forward, obviously, basically since then I've been in therapy off and on for most of my life because I believe in it. And so then, in ninth grade, I decided to like be a really ballsy ninth grader and showed up, to my family's house and I saw like my perpetrators because there were multiple, and I saw two of them and, just was like, yeah, what? Like, I'm 15. What are you going to do about it? Right? It was really funny. And my brothers came with me, and it was this like, we're going to do this together. And it kind of continued that, just like I maintained that strength in that process for so long. And, you know, and then over the years, I've taken more and more steps to just really reclaim my power in that process. And this is just like one facet of the trauma that I've experienced. Because obviously, you know, I'll get into kind of what I believe trauma to be, and that I believe we're all survivors of trauma. And that's obviously changed with time and education and experience. But ultimately, you know, over the years, I just continue to kind of do things to reclaim my power in what happened. And I also know that in my trauma journey, you know, doing EMDR as a client, and, you know, doing all of these, like trying meditation, trying energy work, trying like essential oils, I was like open to most things, because my trauma impacted every part of my life. It impacted my friendships. It impacted my relationships. It impacted the way that I viewed the world. I had night terrors for years. I mean, I was afraid of the dark until 4 years ago, to the point where like going to bed like utterly terrified me, because all of my abuse happened at night, right? So it's, I like would do all these things and just convince myself I needed to be a grown-up, and like I live on my own. Why are you afraid of the dark? So all these weird little things that I would try and do to really find peace. And you know,
I think that, sorry to jump in,
please.
but I think that just speaks to like the programming that happens
absolutely.
in society and in culture. And I think we can get to that a little bit later too, but just to touch on that sense of like, but I'm an adult now and I should just be over it. And it I shouldn't be afraid of the dark, or I shouldn't feel this way. I should just like pull myself up by my bootstraps and just be okay. When that just continues the victimization process and just continues to perpetuate the cycle.
Or I should be broken and stay broken. Right. It's like it can be the opposite side of it too.
Exactly. So yeah, just I think that for me is one reason why this topic is such an important topic that I think we as a community need to talk about on a much larger level. So that we can all be just more trauma informed and aware, and know how we even unintentionally perpetuate those beliefs. And those things.
And I think particularly, I mean, this is a total segue, but because you brought it up, even thinking about just perpetuating trauma culture, and I mean, that happens every day. I mean, it happens in media, it happens like on TV and social media, it happens in all these different areas, where people are no longer feel safe to share their story. And that's where I think in us sharing our own stories, and we're healthy and we're well adjusted, and we can, you know, live lives, and we can maintain, you know, we can have a home, and we can be functional, and we can be sober, and we can be
and have connections and
relationships and friendships and families. And I think that we don't see that side of trauma. We don't see people surviving and living incredible lives.
Well, like you said, there's that like insinuation that, okay, you should stay broken then, right? Or if you allow yourself to be vulnerable and to talk about it, then you need to stay there in it, rather than just allowing the experience of the moment and the emotion and the release, and then being able to move on, you know, and not seeing ourselves or the individual as the multifaceted fractal and person that they are, rather than just that one piece.
Right. And I mean, I remember being told by one of my friend's moms in high school, and she said, like, she basically said, you're going to be dead in 2 years. And I was like, why? Like, what makes you think that I'm going to be dead in 2 years? And she said, well, based on everything that you've been through, something's going to happen. And I just remember thinking, like, okay, that's weird. Because it never occurred to me that I couldn't survive what I had been through. It never even occurred to me. And that's, again, I think some of that's just my parents. I never like, you know, my dad has a 9th grade education, and my dad is a survivor of, you know, violent trauma. My mom's a survivor of sexual abuse. My brother's a survivor of sexual abuse and violent trauma, right? So it's like, and they all are so successful and such incredible people. And so to me, I didn't know that there was any other way to do it except for to just like rally and get help and do whatever you could to be healthy.
And you think that's because of the way your parents handled the situation?
Yes. And what they modeled to me. You know, because I think, you know, I have a lot of people in my life that have been through almost identical trauma. And the way that we ended up is so different. And the only thing that I can attribute it to is that. I mean, obviously, you know, I've been really nerdy about reading into resiliency and, you know, are we resilient by nature? Are we resilient by nurture? And are these qualities that we learn? And because sometimes I wonder if that's it too. Right. You know, am I just like, was I just super resilient and I didn't like have to learn that? I just am that. I don't buy it. I really believe that there's all these environmental factors that played a huge role in me getting to the point where I am. I just can't believe it any other way. Maybe that's like nearsighted, but I'm attached to it, so, and I'm okay with that.
Yeah, I think it's a combination of things, you know. I mean, I can speak to just some of my own experiences of, at the time and growing up, not even recognizing that it was trauma.
Right.
And, you know, to go back to a little bit like you mentioned, Jenny, I also believe that everyone in one way or another, one form or another, is a survivor of trauma. And, you know, we tend to hear that word and have whatever perception or stigma or belief about that, and what that means, and can dismiss our own experiences, you know. But I'll never forget being in my therapist's office, just talking about some childhood experiences and this and that, and the word trauma coming out of his mouth. And I literally like tilted my head and went like
the dog head.
What?
Yeah.
But that moment for me was so validating. And it just took all of these years and years of experiences as a child of loss and abandonment and emotional abuse or neglect and even sexual trauma. And it finally put all of these pieces in perspective and just validated what had happened.
Right.
And the reality and the severity of what had happened. And I don't share that as, you know, from a victim place or, you know, in victimhood. It was finally validating of, oh, like, there was a lot of pain there.
Well, and what happened to me was not okay.
And what happened to me was not okay. And having another person from an outside perspective say and acknowledge you didn't deserve that. And it wasn't your fault. So just finally having that perspective and having that affirmation was really, truly, I think, one of the key factors of what started my own healing journey. And one, just acknowledging it for myself and learning to validate myself, but also just allow another person to as well. So I say that because I think that those are key factors.
Right.
And I think that, and now for my adult perspective, I can also look on all of my lived experiences and even perpetrators and those that I hated or had the most anger towards, and really genuinely just have a different perspective of, but what happened to them also,
right.
you know,
Absolutely.
and you know, acknowledge that there were things that happened that weren't necessarily anyone's fault, you know.
One piece that I think you brought up, Alisa, that I really think is so crucial is, as a survivor of trauma, we normalize it. It's normal.
Right.
Like, it is our normal, whatever that is.
Right.
If that's, you know, a woman that gets catcalled walking down the street, that's pretty normal.
Right.
It's not okay.
Right.
But it's normalized. I didn't know that what was happening to me was not normal.
Right.
Like, I thought that every kid did that.
Right.
I legitimately was like, oh, what? Like, I felt loved. I felt, so it wasn't, I didn't feel mistreated. And I was being severely abused. And I, like, had this belief that it was just like a thing.
Right.
It was just isn't this what kids do?
Right.
And until it stopped happening, and the only reason why it stopped is that we just stopped going there as much. I found out later why. But then I had this, like, yeah, I don't really like that. It's, like, not a good time.
Right.
But it was so simple in concept of just like, yeah, that I don't really like that. Just like I don't like, you know, mushrooms or whatever, right?
Right.
So the way that you just said that was like, until someone labeled it, it was my normal. It was my lived experience until someone told me different.
Right.
And that's where I think these conversations are so crucial, because maybe your normal or your lived experience might be what someone else thinks is normal, and then they hear someone else say that they're a survivor of trauma. Well, you survived the same thing.
Right.
And then maybe that will give them language.
Right.
To say, like, oh, I do have trauma.
Right.
So that's important.
And thank you for that. And I agree. And that's part of why this is such an important topic and conversation for me, is to just empower ourselves, but also each other, you know, to start having those conversations. And, you know, as much, I'll also say, as validating and empowering as it was hearing that for the first time, of that's trauma, it was also like, it was devastating. And but also for me, part of my journey has always been, but I don't want it to define me. And that's not all of who I am. And finding those, you know, like you said, also finding those ways to take our power back in all sorts of avenues is important also. I forgot where I was going with that. But.
That's all right. Well, one thing you said is it's not all of who you are. And what's funny is my immediate, like, gut response was, it is in every part of me.
Yeah.
That was like just, I had that visceral, like, I disagree, but I don't disagree. But
Yeah.
it's in every part of me.
Mm-hmm.
It informs every decision that I make,
Mm-hmm.
whether I want it to or not,
Mm-hmm.
right? It is in every space that I am in because it's a part of me.
Yeah.
You know, I, like, having been diagnosed with PTSD and, you know, like, navigating, like, having triggers and what all that shit and what that looks and feels like. And, you know, luckily, like, through so much work, I don't have many symptoms anymore.
Mm-hmm.
They're little, the ones I do have.
Mm-hmm.
Right before we started recording, like my little sensory sensitivities, like things like that.
Mm-hmm.
But they're just these, like, kind of, I see them now as like these kind of beautiful little just like reminders
Right.
of I'm still here.
Right.
And I'm okay, but I'm still here.
Right.
Right? Because I think that for me to leave that, like, little girl in me that was so abused
Mm-hmm.
and to compartmentalize her into, like, this is my abuse and that's separate from me. I'm so much more than that. So for me, like, loving her and accepting her, like, as a part of everything that I do has been really transformative for me. We're saying the same thing, but
Totally.
I envision it in a very, like, I guess, like, complex way.
Well, but I think it's also a very beautiful way. And I think that I agree we're both saying the same thing. But even just hearing you, like, share that, because I know initially in my journey, like, loving and embracing that little girl who was scared and lost and angry at the world and everybody, so desperately needed to be just held
Right.
and loved and seen, and finding those ways to acknowledge that was so beautiful and so healing. And I think it's easy for me now to get a little bit farther removed and to say, okay, I can compartmentalize now, right? Or it's not all of who I am. Because it's not, but it does, and it can intrinsically affect everything still. How I view the world, how I view myself, how I view relationships, how I just see everything.
Even how I, like, appreciate sunsets.
Yeah.
Like, even, you know, just something came up the other day where fire was this is weird, but fire was a very big safety net for me in my abuse. So there was a wood burning stove in one of the rooms, and I would just watch the fire intently. And so I, like, love fire. I, like, if I could, so much so that I've fallen asleep in front of my fireplace, and, like, I'll wake up and I'm like, I'm
Sweaty?
no, like, the blanket that I'm, you know, covered in might be, like, mildly hot and concerningly hot on
almost
fire.
close to the
Yeah.
fire itself.
Yeah. So, like, I love it. It is one of the most comforting things to me. So even how I appreciate just, like, these basic little things are so important. And compartmentalization has been a huge part of my journey. I mean, there were years, it took so much therapy. I mean, I remember, like, thinking about my experience and being like, yeah, I am kind of 3 different people, and not in a diagnostic way, but
Right.
in a, like, I can function from a very logical space. I can function from an emotional space pretty poorly, but I can kind of do it. And then I can function from a physical space, and I didn't know how to do all at once. Like, if my body hurt, I could not tell you what emotional response I was having to that. If I was, like, sad, I could have no logic in understanding why I was sad. There was, like, no way for me to connect the dots. And then when I finally learned how to do that, that changed my frickin' life. And I remember being like, whoa, like, feeling my body in a way that I had never felt before. And I just remember like crying and being like, this is what having a body feels like. This is what, and it took me getting diagnosed with lupus to do that. I had to get like diagnosed with a chronic illness to be like, oh,
Wow.
I can have a body that's in like excruciating amounts of pain and have an emotional response that happens simultaneously, and I know it. Like,
Right.
I know that both are happening, and I can be like, I'm really sad because X is happening to my body. And thinking like, and this was in 2008. So 10 years ago was when I finally like was able to like begin that process.
Right.
So it's crazy. So to me, the journey looks different for everybody.
Totally.
And compartmentalization was crucial for my survival.
Totally.
And until I was ready to no longer compartmentalize, ready in mind, body, and spirit, I didn't. And I couldn't.
Right. Well, and I think that brings up such an important point, is that like every journey looks different. And it's so easy for us to fall into that, well, maybe I'm doing it wrong, or maybe I'm not as far along as you, or maybe I need to do more work, or I
I'm
need
more
to do
sick.
this, or I'm more sick,
Yeah.
or I'm more broken.
Yep.
I personally hate that word broken.
I do too.
I don't believe that any one of us are broken.
Right.
I believe that there have been things in my life that have felt like they could break me. But I get to know today that I'm not breakable, and we are never, ever broken. That we as humans are, and as women, are so much more resilient and powerful and healing than we even know. And so that's my soapbox for the moment. I hate that word broken.
Yeah.
Um,
Well, bones
but-
break.
right. Bones break.
Feelings
right.
hurt.
Right.
Bones break.
Right.
Right. And to
Right.
me, it's so different.
Right.
You can wear a cast
Very.
and repair a bone. A cast isn't going to fix trauma.
Right.
It just won't.
Right.
You could put me in a body cast.
Right.
Probably just traumatize me more.
Right.
You know?
Right.
So I totally support that.
Right. So we can all be at different places in our journeys at different time. And what I also know from my own experience and journey is there are different phases of my life that will bring to light different pieces of what I need to heal.
Absolutely.
So entering into a new relationship can
Yep.
be one.
Yep.
Or new friendships, or
New job.
Yep.
Yep.
Any sort of big life change like that,
Mm-hmm.
and or big life events. Different phases in the relationship that I'm in can bring to light different angles and different pieces of those experiences as well.
That's why I
and-
believe that we never are healed from trauma.
Right.
You're not recovered from trauma. Because at every juncture, we're learning new ways to live with the trauma we've experienced. It's like every stage, and that's why I keep going back to therapy. So I'm like, well, like here's a new way that it impacts me, and I had no idea until, I had this really cool experience, and or I had this cool experience, or I had this experience that sucked and reminded me of all of these other things that I've experienced.
Right.
Or
Right.
trauma that I forgot that I had.
Right.
So
Right.
absolutely.
So that the journey is an ongoing process. And I know what has been so vital for me is learning, and still I'm not perfect at it. I tend to be my own worst enemy, but practicing that compassion for myself, and being patient with wherever I'm at along the journey, in whatever way,
Yeah.
has been really, really key.
Absolutely.
That's interesting. The part of like where you talked about like different things bring up different parts of trauma, like relationships,
Mm-hmm.
things like that.
Mm-hmm.
And to touch on like what is trauma, I know you'll get into that, but like when I got sober and I got into a relationship, like that came up in my therapy session about my trauma and some stuff. And like my dad left when I was little. My real dad left when I was little. He just left. Never heard from him again. And I was 9, so it wasn't like, I mean, I remember him.
Right.
And so when I got into this relationship and like all of my past relationships with men and how I interact with men, and, you know, my therapist said the same thing, like, you know, that's trauma. That's you were abandoned by your father. And, you know, I've done a lot of work on that. And, you know, I've done a lot of work on that. But, I had no idea that something like that was trauma.
Right.
You know, like I had other things. And, you know, when I got sober, I remember I would tell my therapist, like, I had a really good childhood. Like, you know, I don't remember anything traumatic happening to me as a child. Like, why did I turn out like this? And I wanted to know, you know, why I turned out like this. And that deeply affected me.
Right.
That deeply affected me. And I had no idea that was even something that was so traumatic in my life, you know, because I did have such a great stepdad, and I never really felt the void of my dad leaving until many years later. And it's just, it affected me terribly in all of my relationships and the way that I am in relationships, and it affected, you know, my relationship with my mom. And, you know, I have mommy and daddy issues, but both. But that's interesting to me, all of the things that, you know, we consider to be trauma. And that's just one other thing, like we talked about at the beginning, that we all have traumatic events and have trauma.
I want to just touch on that because I'm totally putting you on the spot, so
Okay.
I'm going to own that. Not in like an invasive way.
Oh, no.
But I do remember, I remember you saying something to me along the lines of, I don't really have a ton of trauma. And you use that as a way to minimize the experiences that you've had. And in my mind, of course, and you and I've had this conversation where I'm like, Lacey, that's not true.
Yeah.
Like, I know that's not true.
Yeah.
But we do get caught in this narrative of like, well, my trauma's not this, so that means that I don't have trauma. And so kind of coming full circle to what is trauma. Listen, to me, if stubbing someone's toe like is emotionally distressing to them, that's trauma. It's not the incident. It's how it impacts us.
Right.
Because, you know, a really like graphic, violent, horrific thing that happens like, you know, on the streets of an urban city, I'm being stereotypical obviously, like, and then something that happens in, you know, like a middle class like family home could feel equally as horrific. And so to me, to label trauma based on a series of criteria is bullshit.
Right.
Totally.
It is. And it's unfair. It's unfair to the survivors of those incidents. I mean, being an active substance user is traumatic, even if you've never had any trauma leading up to that. Right? The isolation, the loneliness, the lying, the self-hatred.
The loss.
Like,
Exactly. And I think, to touch on what you're talking about, Jenny, I feel like it's so easy for us, you know, like Lacey, like you shared, for us to say, well, but my trauma doesn't look like what you're sharing. And it doesn't even come close, so mine's not that bad.
Right. And it took me a really long time to figure that out.
Yeah.
Because I didn't have, like, quote unquote, these horrific things in my mind.
Right.
So mine didn't really matter as much. Mine wasn't trauma to me. And I feel very differently about that. And I think that's why this is important to talk about, because, you know, people don't even realize that it's trauma and, you know, how it affects their life and their relationships and their jobs and the way they interact with people and you know, their relationships with their families and
people don't even realize that, I have clients that'll come in and we talk about PTSD and they say, well, I'm not a veteran. I'm like,
right.
Like, PTSD is not like saved for veterans. And, and then talking about, well, when I've talked about my own trauma, people say, oh, did you go to war? I'm like, kind of, but not the kind that you're thinking of.
More like an
I'm
inner war.
Yeah, I'm not in the service, if that's what you're asking.
Right.
And so we have this like very limited worldview of what trauma looks like. And it's so underreported too. So we don't have, I think, a very good social mechanism in place to really talk about what trauma is happening in our communities even. It's so filtered through, so many different lenses. And so we lose a lot of what's happening to people on a daily basis. Witnessing a car accident, witnessing a loved one get into an altercation, witnessing trauma, even hearing about trauma can be traumatic, right? So that's a big piece of it too. Maybe you like helped a best friend while, after they were sexually assaulted and took them to the hospital to get a Code R exam. That's traumatic, right? We all have our own feelings. When we go into this animal instinctual reaction response, our body is in a trauma response.
Right.
No matter what the reason is. That may even be if you have a child and your child like falls and gets injured and you go into this like reaction of like, I need to protect them, I need to care for them, I need to hold them, I need to make sure they're okay. That's a trauma response. Is it different than another type of response? Maybe. Might be, less severe, but it's all the same.
Right.
Like what I found is that the way that trauma is stored in people's hearts and in people's bodies doesn't differ much. It's even when the content is wildly different and across the spectrum.
Well, and to go back to like what you said in the very, very beginning, the details really are irrelevant. And I agree. For me, the details are irrelevant. It's remembering that innate fact that we all breathe the same and we all bleed the same.
Yeah.
And those experiences, I think you just said it so perfectly and beautifully, how it is stored and felt in the body is all the same. And so I feel like if we can have these conversations on the larger level and stop dismissing other people's experiences and other people's humanness, that, and not to see others as broken or helpless or flawed, but as resilient and just practicing compassion.
But instead, our culture teaches us to victim blame. Right? So what did you do wrong? I mean, this is like very stereotypical again, but like if a woman's sexually assaulted, she's asked, was she drinking? What did she wear?
Well, I think of so many of my own experiences. Right. And I will speak to that. And that was one of the pieces that took me a long time to get to with my own therapist, because that was one specific that I could blame myself for.
Oh, easy.
Right?
Yeah.
Because I was drinking. It was my fault. I put myself in that situation. I asked for it.
Or I consented in part of it.
Right.
And then I changed my mind.
Right. And then for, years later to realize, but I didn't deserve that.
Right.
And no matter what, under any circumstances, no means no. And if we can, put the awareness out there, and I know I'm preaching, but stop the victim blaming. I feel like all of these, I love, it breaks my heart, But I love watching all of these women stand up and step up.
Mm-hmm.
You know, the Me Too movement and all of these victims come forward. But we need to stop the victim blaming.
Right. We also need to create space for communities that are disproportionately affected by trauma,
Mm-hmm.
right? Communities of color, low-income communities,
Mm-hmm.
generational violence, right? Like all of these things that I think get missed in the movements like Me Too.
Mm-hmm.
And I think Me Too is incredible, and there's so many
Mm-hmm.
things about it, but I also think that there's so many pieces that get missed.
Mm-hmm.
There's so many communities that are, like I said, disproportionately impacted by trauma and violence in a way that in my suburban white community, I'm never going to see. I'm
Right.
never going to experience.
Right.
And, you know, you look at generational trauma from all of these different major societal events that have happened in history and how that impacts families.
Mm-hmm.
You know, I look at generational trauma in my own family
Mm-hmm.
and, you know, what that looks like. I look at, you know, my parents' trauma, their grandparents' trauma, the trauma on me and my siblings, and how that's impacted my nieces
Mm-hmm.
and nephews.
Mm-hmm.
And, you know, what do we need to do to stop trauma from continuing in our communities? And it's all about communication.
Mm-hmm.
And, you know, another group of people that I think that get lost in the trauma conversation are men. And,
Agreed.
you know, so many male survivors feel so silenced
Mm-hmm.
in their own experience because of the need to present as masculine or the need to present as strong, or like their fear of like homophobia
Mm-hmm.
and talking about, you know, being, you know, sexually perpetrated on, and, you know, it being a male perpetrator. And then what does that mean about me?
Mm-hmm.
Like the homophobia in our culture impacts so many different things.
Mm-hmm.
And there's all these different facets that I think really, aside from victim blaming,
Mm-hmm.
right, prevent people from even being able to come forward and say, I'm a survivor.
Right.
And I don't know if you guys watched, so this was forever ago, it feels like forever ago. Oprah did a television series for male survivors of sexual abuse. It was so freaking cool.
Mm-hmm.
And I still think it missed the diversity and really being inclusive in terms of demographics and different populations.
Mm-hmm.
But what it did do was every member of the audience was a male survivor. And they held a picture up of themselves at the age that they were abused. And I had so many men in my life that came out to me about their own experience with sexual abuse, with domestic violence, with being the victim of a female perpetrator in domestic violence. And it was in a way that was really mind-blowing. People that I thought, you know, that had been around me and had been around all these other survivors of trauma were talking about trauma all the time, and they never said a word.
Right.
And that really shifted a lot for me in the way that I viewed men, because what we know is that male survivors, then like statistically, it's a little bit less than women, but not much. Not much.
Mm-hmm.
And so where are those voices, and
Right.
where are those stories?
Right.
And where is the space for them to start to talk about those experiences? And where is the space for women to start to support each other
Right.
in those experiences? Because I think we hurt each other more than anything when it comes to talking about trauma, sharing our trauma,
Agreed.
supporting each other in trauma healing, and you know what all that looks like. And to me, it is simple. It is as simple as how does the person they tell respond to them? And that's my own bias, because that's my own experience, right? So that is always at the forefront of my mind. If I am the first person that they are telling this to, or if I am the 5th person they're telling this to, or the 50th,
Right.
I am going to guarantee to respond to them with love and compassion.
Right.
Because maybe that will help them feel safe enough to tell somebody else. Maybe tell someone else that can provide them with resources to help them learn and grow if that's what they want.
And my thought to that is, if anything, to not perpetuate the shame.
Yes.
The shame is already debilitating as it is. And for me, I love bringing women together. I love the women in my life because the women in my life have been so healing for me.
Yeah, me too.
And so powerful. There have been those that haven't been also. And for me, like, my vision is just creating that for us as women to come together to, stop the comparisons, stop the jealousies, the comparisons, really, and set all of it to the side and just be present. For me, it's an honor when the women in my life come to me in their darkest moments or their hardest moments. And I think that if anything, can remind the community and remind and teach others, don't be afraid to sit with someone in their darkest moment. I think we're taught to, we get afraid to talk about our own pain, let alone hear someone else's.
Right.
And so we shirk away from it and we dismiss it, or we try to lighten it up, or, for me, just sit with it. You don't have to fix it.
Right.
You don't have to have all the answers. Just be present and just hold that space with them. It's really that simple.
It is. It is. Being believed and being, like, cared about and loved.
Right.
I mean, sometimes, really, that's all that needs to happen.
Exactly.
For a lot of people.
Exactly.
A lot of people. And not just, and doing that for each other, but also doing that for ourselves.
Right. And
not minimizing our own experiences of, like, mine's not that big of a deal, so I'm not going to talk about it. Or, like what I brought up that you've done, just like, oh, but I don't have, like, that kind of trauma.
Right.
Right.
Well, I think I think what you're saying, thank you for saying that, I think it's crucial. Like, because even thinking of my own experience, like, I look back on that and, like, I would talk to my mom about it and, like, it would be, like, shoved under the rug.
Yes.
And it wouldn't be, like, a response of, like, I want to validate your feelings about the situation. This is what's going on. Like, it was kind of like this hush-hush thing that we wouldn't talk about. And so it got stuffed somewhere deep down in there, and came out in totally different ways all over the place in my life.
Yeah.
But I think that's crucial. Like, I think if I would have had a different response as a child, and it would have been of, like, love and understanding and validation in what I was feeling, because I didn't realize what I was feeling. Like, there wasn't this big loss that I was feeling, but I felt like something was missing, or something, like I was left behind in a way. And that I didn't, like, I loved my stepdad, I still love him, but I didn't quite fit in their their family, and there was that separation, and it all flows together now. My kind of how I ended up where I ended up, and all of that stuff. But yeah, that response is crucial. That first, and you talking about that makes me even more aware of that, and just like how your family handled your stuff, and yeah, it's crucial.
And I'm sure my parents beat themselves up over how they handled it. I'm sure that they've, like, questioned, why didn't we do this? Or I don't know. We actually haven't had that conversation, and we talk about this kind of stuff pretty regularly. But it was perfect for me.
Well, I feel like we can all in every situation in hindsight replay it all over again and say, well, I should have done this, or I should have, all of the should haves, and I think what comes to mind out of this conversation right now for me is, I don't know, Brene Brown just keeps coming to mind, like allowing ourselves to be vulnerable. And like Lacey, hearing your experience, like that, and I'm sorry that was your experience of feeling minimized, or like, no, hush, hush, let's not talk about it. I know that was my experience in many, many ways also. What I know now is, and what I can have a deep sense of compassion for now, is seeing, oh wow, they didn't want to sit with the pain though.
Right.
That was too painful for them to acknowledge. They didn't know how. They didn't have the ability or capability to even sit with that at the time. Therefore, perpetuating their own traumas. And then, hence, the cycle just continues to repeat.
Right.
Over and over and over, generation after generation in my family, not knowing, any of us, what was really even happening.
Yeah.
So I, not that that's ever okay, but
no, I get it.
But I think, like, yeah, totally. And, but I think that's why these kinds of conversations are important. It's okay to talk about these things. And, if we don't feel like we are in a place emotionally or mentally or capable of sitting with it, then let's help each other sit with it, whatever it is.
I have my go-to people when stuff like that comes up, right? That I'm just like, yep, here it is, rearing its ugly head. Let's want to help me go down this rabbit hole,
right?
And so knowing that I have a crew of support, but let's be real, like, how many people have a crew that they feel like they can talk about this to? I mean, because, like, we want to protect each other. We want to, we want to make sure we don't want to hurt anybody. We don't want to. So many people keep quiet about this kind of stuff. So quiet.
Well, I think it goes even further than, like, not wanting to hurt anyone or protect anyone. Like, people don't have people sometimes to talk to. I think
often.
of, like,
often,
I think of, like, the populations that you were talking about earlier, and, like, I have people now, same thing as you, like, I have a whole crew of people that I can go to and talk to, and, but I think of, like, when I was in my active addiction, or, like, other, like, I didn't have anyone to talk to, and I think that's more the case than not.
Absolutely.
And so how did those people get out of that?
Exactly.
Well, and I think
a real question.
It's totally, because I think about the clients that I work with, right? And obviously all the clients that I see, or most of them, have some pretty complex trauma. And in working with those clients, I mean, most of them come in and are like, oh, I don't have any trauma. I'm like, okay, cool. I don't believe you, but we'll start where you're at. So we start where they're at. And then, a week in, it's like, oh, hot damn, there's like trauma after trauma after trauma after trauma. We can call it like Skittles if you want. We don't need to call it trauma if that makes you feel weird.
Right.
And, but most of them don't even think to talk to people about it, because they don't have people to talk to about it, and no one cares. And it's not that people don't care, but I think people, I don't know how many times, people have found out about my history and they're like, I'm so glad you didn't tell me. That would have, like, been really weird to hear. Like, what do you say to someone like that? What do you say when someone shares stuff like that? And so I think just as a community, we need some coaching on how to not just how to respond to people when they share with us, but how to just talk about it in a way that isn't hurtful. Like making like rape jokes aren't funny. Making jokes about like violence to others is not funny. And so even down to a simple things like that, because someone that feels alone, if someone makes like a violent joke about like beating their spouse, and this client is, currently being beat by their spouse, you think they're going to go up to their friend and tell them now? No. Right?
No,
And
right.
so a survivor of trauma, the cool thing, it's not cool, but I feel like it's my superpower. Being a survivor of trauma, like I'm scanning my environment always, right? It's kind of like the thing in, everyone that knows me knows that when I sit in a restaurant, I like my back. I have to watch the door. So I need my back to the wall and I want to see anyone that's coming in and out. It's just like a weird little thing.
The same way.
Yeah. So it's like all these weird little things that I have, but that's the kind of stuff that keeps me safe. And so, like thinking about someone who's a survivor of trauma, they're always scanning their environment. Who's safe? Is there someone that's safe that I can tell? And I'm going to watch them. So maybe it's a best friend, but I don't trust them that much. So every time I'm with them, I'm going to watch what they're doing. I'm going to listen to what they're saying, and I'm going to constantly assess. You think I can tell them? Not today. They're a little edgy today, or they're this today, or they seem a little overwhelmed. I'm not going to bother them today. So then it gets put off. Then they maybe go out and they make a joke about something traumatic, and then it's like, yeah, no, not going to tell them today. So it's really interesting how, like, talking about being trauma responsive and trauma informed, that is the kind of stuff we need to be aware of. What are the things that we're doing that could shut someone who is scanning the environment, looking for someone to tell what's going on for them, and how can we be available in language, in body, if we want to be? Because let's also be really honest.
Not everyone wants
Not
to be.
everybody wants to be.
Right.
And it's hard to hear other people's trauma.
Right.
It is. And I don't expect everybody to do that. And so that's a big piece of it too. Do I not want to be? That's okay. And knowing what our own limitations are around holding space. I mean, my mom, perfect example, she is like the most supportive, like beautiful human being. And when she hears people's trauma, she like soaks it into her body, and then she gets sick and she's sleepy, and it impacts her physically, and she's like, I can't hear this kind of stuff.
Right.
So she can't watch the news even. It's too much for her body and her spirit. And so she has to really protect herself in that way. And she knows that about herself. But that takes a lot of self-awareness that I don't know that everybody has.
True.
Because I could hear trauma all day long. And it impacts me differently than it does her. So being aware of that too.
It's interesting. When you said the trauma response, like when you sit, I just want to talk about this because it's interesting to me, where you have to sit in a restaurant with your back so you can see. So something for me, and I don't even know where it comes from, but I'm assuming it's a trauma response. I don't like being in places where I can't escape from.
Yeah.
So like, I can't do, like, if there's a big long table in the restaurant, I can't do in the middle of the table because I need to be able to get out if I need to. Or like at concerts, like I will scan, I like they use that word, I will scan, like I have to, like if I'm in the GA part of a concert, I have to be able to like see that I can get out.
Identify, the exit path.
And even like when I go and visit patients sometimes, like the locked units. Really gives me anxiety because I feel like I can't get out. So that's interesting.
And like I said, to me, it's a superpower. Because it's this really like interesting part of our bodies that kind of just happens as a result of trauma.
It becomes such a natural thing to be able to almost instantly walk into a room and instantly even energetically know where
just will
where
hit me.
everyone's at.
Yeah.
Yep.
Right? And sometimes it can feel like overwhelming anxiety because it's so much. Or sometimes it can be just be different all the time, but that is a natural, just that hypervigilance of constantly, and I do it always also. I have to be facing the door, no surprises. I can't have myself tucked in a corner, and I even just like unconsciously most of the time can have a pulse on what's going on, who's there, and it's just innate because of having to be so in tune with your environment.
Self-preservation. There's a Ani DeFranco song, and one of the lyrics is self-preservation is a full-time occupation. And it's true. At least for me, it's true. In a trauma response kind of way. Like constantly, am I safe? I mean, even at my house, because my trauma happened in a safe place or supposed safe place, right? So even when I'm in my house, I don't answer the door. I have a trauma response when my doorbell goes off. So I just won't answer it. I if you randomly want to show up to my house, just don't, because I won't answer your door. Yeah, just let me know.
Call before.
Yeah.
Okay.
Little things like that. So there's just all these, when I have a bunch of blankets, I need a lot of weight on top of me to feel safe for whatever reason. There's all these little nuances that I've picked up over the years that I'm just yeah, that's totally trauma. That's totally my trauma response. And not judging it. I just know this about myself, so I'm just going to roll with it. Some of the stuff that prevents me from living my life, I'm going to address. But little things of I'd be more comfortable if I sat here as opposed to here. Can I sit here? Yeah. And I will if I need to. But is it a big deal if I sit here? Not really. So then let me sit there, because then I'll be at least 70% more comfortable.
Right.
And be able to be present in a different way.
See, and even having this conversation right now, that what you're talking about is so helpful to me, because I will judge myself on that. I've gotten way better, but it started to get to a point where it would affect, it was affecting my work and me being able to go to social events and different things like that. It's much better now, but that's helpful even just to me in this conversation, just to be okay with it and be it's just part of me. And it's not a big deal.
I'm quirky and weird, and I'm just gonna roll with it.
It's not a big deal if I need to stand a little off to the side at this concert, so that I can know that if I need to get out, I'm probably not going to need to get out. I've never needed to, but just knowing that I can get out is comfort to me.
Right.
And
I think even to take it a step further than that, recognizing that as part of your survival.
Yeah.
Yes, it's part of who we are, and it's our little quirks and this and that. But for me, it's also important in moments to recognize, wow, I actually survived because I am hypervigilant or because I am super sensitive. And so embracing that has actually been a strength also. At times it may feel like it interferes with certain aspects of life, but there's something very innate about that was survival. And I think it's important to recognize that also.
And I always just tell myself that there's a lot of information in the weird little quirks that I've developed as the result of my trauma. And it might be information about myself. It might be information about my own experience. It might be information about my environment. And I don't have to take that information in as facts, but I can take it in as this is something I should look into. If I have the same response to the same thing over and over and over again, I'm going to want to explore that. Why am I having the same response to this thing? Is it something I can work on, or is it something that I'm just going to love and accept as a part of me? And part of that too is letting people in on these little quirks rather than having to suffer in silence. So, you know, my best friend and I will go to brunch, and she always, without fail, will take the chair with the back to the door, because she knows that I'm just like more comfortable in the other chair, right? Like she's just very, very aware of that. And it literally is that simple. And, you know, some people might see that as enabling, or like, why can't people, you know, why can't you just like suck it up? I could. I know I could, and I'd be fine. But like, why create more distress when like the adjustment is so minimal? Because I am always working on myself, and I'm always working on the things that I need to become a better person, and the way that my trauma has impacted me. I'm always pushing myself harder and harder and harder. But at the same time, like, there's just little things that I'm like, I could easily make this adjustment, and I would literally feel 50% better for the next 2 hours.
Right.
And so why not ask for it?
Yeah.
Right.
Why not allow other people to love those parts of me too?
Right. And asking for our own needs.
Yes. Well,
And validating that. Because,
Yeah.
you know, how often do we just minimize, or, oh no, I'll just suck it up and deal with it, or
And then
this
have
or that,
severe anxiety for
and
the
then
next
have
2
severe
hours.
anxiety.
Right.
Right.
And all you needed to do is just be like, hey, you guys,
Yeah.
can we be over here?
Yeah. Instead of making myself suffer.
Right.
Right.
Yeah.
Right.
Yeah. So.
Well, and,
Right.
you know, again, like there's, you know, my best friend, her therapist actually told her this and just said, you do not have to participate in your own abuse or the perpetuation of your own abuse. And so often as survivors of trauma, we continue to perpetuate our own abuse by doing stuff like that, by making ourselves suffer over something so simple. That continues the abuse cycle. Rather than saying, yeah, I'm not going to let myself suffer over something that's so simple. And how can I take care of myself in a healthy way, in a productive way, and in a way that really honors myself, so that I don't have to participate in my own abuse anymore.
Right.
I don't have to victim blame myself. I don't have to judge myself because I feel this way. How can I give myself freedom to just be me? And that's where I think there's so much value.
I agree.
So I hope that comes from this conversation too.
Totally.
You know, for people to start to identify, what do I need in order to feel more safe and more seen in the spaces that I am in? Does that mean that you tell people of your trauma? Maybe, but maybe not. Maybe that just means you start to ask for what your needs are in these different ways. You know, obviously we work in the helping profession, so it's our world looks very different than like a corporate world. We can ask for our needs to be met in a way that like someone in a corporation probably can't.
Very true.
You know, so how do we help people navigate their environments? And that's something as a therapist I'm always considering. What are the environmental dynamics that we have to navigate within?
Right.
And how can I support my clients to feel empowered in the systems that they have to function in? It may be a family system that they're not going to walk away from, but it's abusive.
Right.
You know, so how do we help them take care of themselves and ask for what they need? Maybe it means they have their car there and they can leave and have an escape route at all times. You know, maybe that means, who knows? But that is so crucial in trauma work too, is identifying what the restrictions are based on, you know, their environment and all the environmental factors. Because when, you know, in isolation, it's one thing to do trauma work, but none of us live in isolation.
Right.
And just like in recovery, right? Like with substance abuse, you don't get sober in 100% isolation from drugs and alcohol. Just doesn't happen. So how do you get sober when you are constantly inundated with, you know, advertisements, with substances, with people offering to do, you know, X, Y, and Z, or, you know, drug dealers reaching out to you, or whatever that may be. And it's the same with recovery from trauma. You know, I really don't believe that recovery from trauma and recovery from substances is much different.
Mm-hmm.
If you look at like how the 12 steps helps people in sobriety, the same concepts apply
Mm-hmm.
to trauma and trauma recovery.
Absolutely.
Because what is the thing that helps me to feel more productive, and not get caught up in that selfish spiral of I'm a victim,
Mm-hmm.
is helping other people, right? Is
Mm-hmm.
acknowledging how my trauma has impacted the people that I love
Mm-hmm.
by making amends. Meditation, if I didn't meditate, I'd be a psychopath. Probably not, but I'd just like hold it in. Closet psychopath, I guess.
We just build and build
Yeah,
and build and
like,
build.
you know, meditation, doing spiritual work,
Mhm.
Identifying powerlessness. I can't control what happened to me.
Right.
You know, to me, it's so making amends, resentments.
Mm-hmm.
It's all the same.
Which brings me to a question.
Yeah.
How often do you feel, and you might not even be able to answer this, and I might not be asking it the right way, but for me, I feel like trauma and substance use kind of go hand in hand.
Sure.
In not always, but
Mm-hmm.
I feel like that's
substance
another
abuse is traumatic, period.
right.
Yeah,
But
if
I
you have
feel
no
like that's
trauma, right.
almost another layer of healing. Like I think that the 12 steps in AA absolutely heal a big part of addiction, and you know, it gives you the tools you need to have a life. It gives you like this daily reprieve. You know, you realize you're powerless over alcohol. You get to clean up your side of the street. You know, find some spiritual connection, and then you get to help other people, and those
Right.
are all extremely important things. But it doesn't touch on any sort of trauma, and I feel
Not
like,
in a direct way.
right,
Yeah.
not in a direct way.
Mm-hmm.
And so I feel like that's a whole nother layer to
Mhm.
healing once you stop using drugs and alcohol.
Mhm.
It is.
That is not always touched on in that circle.
I think
I
that's
know.
absolutely true. Go ahead.
I know for like I'll speak to that just from my own experience also. It was probably not until I was about 5 or 6 years sober that I was in a place where I started to recognize, maybe I should go to therapy too. Because there's some dynamics in this relationship that's going on, and I'm like having these reactions to people that I don't understand why I'm having them. And there were just all of a sudden all of these pieces that I hadn't been able to touch on until that point. And again, like for me personally, 12-step is absolutely my foundation, and is essentially what my life today has been built on. And I absolutely bless all of that. For me, but I will also say it's because of a lot of the principles of the 12 steps that I was able to then go into the next phase with working with my therapist. And then for me, it took off into a lot of other spiritual retreats and self-empowerment retreats, and really kind of whatever presented itself in my path, checking in with, is this helpful or not, and being open to whatever means of healing presented itself. And then it just continues to kind of evolve from there.
Well, and what I see people do, and I think this can be dangerous, is, you know, when folks get sober in early recovery, all of a sudden they're feeling feelings, and then you bring trauma awareness, and oh my gosh, I have trauma, and now I'm starting to feel the feelings of all the trauma, and now I'm starting to process all the trauma I experienced while active in addiction. It's overwhelming. Your body, your mind, it all gets flooded with information. And so what I think people do is want to just attack everything early in recovery, and like, okay, well, I'm going to get sober and I'm going to do the steps and that's going to fix everything. I mean, you know, we have someone that we work with that, you know, is 4 or 5 years sober and just started doing trauma work. because they weren't ready until now.
Mm-hmm.
And sometimes it takes 4 or 5 years
I agree.
to
I
begin 4 or 5 years of sobriety where your brain's starting to function. Because here's the biggest piece. I mean, people come in to treatment and want to start doing trauma work the day that they get there. I'm like, you need to eat like 3 meals a day. You need to like
Drink some water,
like sleep a full night. And then maybe we'll talk about it. But to do trauma work, you have to have basic life skills in place. Because if you are not, I will not do a trauma session or trauma work with a client that hasn't ate, that hasn't slept, and, you know, that is having a hard time bathing themselves. I won't. Because it's not safe. It's not safe for them. It's not ethical. There's so many facets of it. So I do think that that is a disservice for people in early recovery because they do want to just do everything and hope that the 12 steps will solve it all.
Which is part of the addictive thinking in and of
Totally.
itself, right? Yes, I'm going to do all of it. I'm going to just knock it all out now. 30, 40, 50, 60 years of trauma and pain and hurt, and you can't begin to unravel that in the early stages.
Well, and I think a lot of times too, you're not even, at least for me, I'm a great example. I wasn't even aware of it.
Right.
And
Exactly.
I feel like
Exactly.
it wasn't, and that's, you know, a lot
Yeah.
of the times, like I knew I had a problem with drugs.
Yeah.
That I knew
That was
for sure.
obvious. Right. Yeah.
But, and, you know, for me, it was Alcoholics Anonymous was exactly what I needed. And, it really, and still continues to give me, what I needed at that time. But then it was like 3 years sober and I wasn't finding the same relief that I was finding the first 3 years. And then it was like, I want to go to see a therapist. Like I'm in a relationship, all these feelings are coming up, like what's going on with me? And then like we dove into some other stuff. So it's like this revolving thing that, you know, it keeps growing in different ways and then it will come back around and the same thing will come up. And, yeah, but I was just curious, like with trauma and addiction, how they go, if I guess is a better way to say, if they go hand in hand a lot of the time.
Yeah.
And how often does it keep people, like, because I think of like, you know, like people that just don't have any resources, or like the homeless population, or people down at the block, or the people that Mindy helps. Like, I think it's so much more than just addiction. Like, I think it's
Absolutely.
the poverty and the trauma and mental health, and that keeps them down there.
I agree. I don't, you know, I was thinking about preparing, like looking up statistics and stuff before I came in. I was like, that's so inauthentic to who I am. So I'm not going to like even act like I do that. 'Cause I don't. But you know, because I believe that we're all survivors of trauma, and obviously I work with people in early recovery, from drugs and alcohol and various other addictions, I of course believe that they go hand in hand. That's my clinical perspective. Not every therapist believes that. So for me, that philosophy fuels all of the work that I do. And that doesn't mean that I'm identifying trauma for people that don't believe that they have trauma. It's more a matter of, it's a way that I conceptualize their lived experience, so that then we can start to wrap our minds around, okay, what are the next steps? So I don't see them ever existing without one another. Even if there is not any, what someone would perceive as trauma prior to the substance use. You know, like I've said multiple times just in this conversation, is substance use, active addiction is so traumatic. So traumatic. The isolation, the lying, you know, all that stuff I talked about earlier, it's so gnarly. And so even if you conceptually don't believe that you've ever experienced trauma, which I don't buy, but even if that is your individual belief, we can at least agree on the fact that once you started using drugs and alcohol or engaging in active addiction, some things happened that didn't feel right. And there's a lot of pain in that. So that's my philosophy. But again, every therapist is going to believe it to be different. I'd like to say that there are statistics out there that show the correlation between substance abuse and survivors of trauma. But what that doesn't include, I mean, those would be based on very specific definitions of addiction and very specific definitions of trauma. And I don't necessarily subscribe to either one of those. So to me, they are so intertwined.
Yeah.
And that, there's no other way for me to really say that.
Interesting.
Yeah. But I mean, even talking about the populations you mentioned, I mean, mental health is a huge part of that. Trauma is a huge part of that. Again, you don't end up being like an active IV drug user with like a perfect life. But no one has a perfect life.
Yeah.
Nobody.
With the illusion of a perfect life.
Yeah, like no one's needs are ever met. Right? Yeah.
Remember?
Yeah. No one's needs are ever met.
That's true.
Like ever, right? We have these adults that are trying to care for children and try and meet all their needs, but we're always guessing. We're always making assumptions. Oh, we think you're hungry. You can't tell us that, so we're just going to feed you. And you stopped crying, so I guess you were hungry, right? So we're always guessing what other people's needs are, beginning in infancy. So we're always guessing and always guessing and always guessing. So no one's needs are ever going to be fully met. And we're also very used to other people meeting our needs from a very early age. So then you think that when we grow up, we like are all of a sudden going to change. Yeah. So we don't have someone meeting our needs, so we have to learn how to meet our own needs. And again, even something as simple as that, attachment trauma, not ever learning how to like develop a healthy attachment to a parent for whatever reason, or somebody else, a sibling, a family member, a caretaker. That's trauma. We were even talking earlier today about birth being trauma. Right? Leaving like the cozy like nature of the womb and then coming out into this world that's like really loud and bright and scary, and you're getting poked and you're getting, measured and you're getting weighed, and like you just left like the coziest cocoon in the whole wide world. Like, and now all of a sudden you're in this like crazy place.
There actually are a lot of schools of thought of
tons of research about it.
And lots of research and in addition to that, I think the trauma that happens while in the womb, or that the fetus can be exposed to while in the womb, what's going on, even the emotions of the mother, and so many factors. I feel
stress.
I feel like this could just keep going and going for hours, and I think we absolutely just opened another rabbit hole. And Neil, order a pizza, please. We'll just keep talking. I think there will most definitely be a continuation or a to be continued of this discussion. But in an effort to kind of just at least wrap things up for today, again, thank you to both of you for being willing to come just share this space and open the dialogue. And my hope for anyone listening, women and men, is just that hopefully you heard some bits and pieces from today's conversation, and know that you're not alone. You are heard, and we can heal, and we can heal together. None of us have to do this alone. Absolutely. And hopefully we can just keep the conversation going here as well as on a much larger level.
Absolutely.
Is there anything else that either of you want to wrap up with or close with?
I just want to say thank you for coming and
for sure
chatting about it. It was actually very helpful for me too. So I appreciate you being here, and thanks, Alisa, for being such a great host.
Thanks, Lace, for being such a great co-host.
You're welcome. You guys adorable.
And thank you again, Jenny,
Yeah,
for being
it's my
willing to
pleasure.
come share your story in such an incredible way.
Yeah, thank you guys for asking me. I mean, it's a cool opportunity just because I care about both of you just on a personal level, and
Thank you.
so this is fun for me.
It's been really, really fun.
Thank you.
So, thank you both.